around near their doctor's office
For the first month?
for the first 3 weeks or so. In case of any complication, you can go to your doctor to have it taken care of instead of being on vacation somewhere else.
So then, what about, then let's say you're having, after massive weight loss surgery, you're having your breasts redone. How long does that take to feel comfortable? Because it hurts, you know, there's going to be pain.
Well, even though it's considered a major surgery, a lot of incision, but the breast is still mostly skin and sweat glands.
So it will not hurt that much?
So it's not as painful as, let's say, compared to a tummy tuck. Because a tummy tuck, even though the muscle are not touched, but we still reconstructing the muscle.
Okay.
So it will be more painful than compared to breast.
So you actually, for the tummy tuck, suture the rectus abdominis?
No, we don't suture the rectus abdominis, but we suture the fascia, anterior rectus sheath.
Okay.
We you know, it has the tensile strength that we can suture it together.
Okay, and that will be
to bring the
a
muscle
bit
closer,
okay.
but we don't actually touch the muscle itself.
Okay, and then there's also incisional pain. So let's say the breast lift will take about a week to feel normal. A week to 10 days? 2 weeks?
Well, I mean, after about 3 days or so, they can actually tolerate the pain. They don't have to take narcotic pain medication anymore.
Okay. Probably another 2 weeks. Probably a total of 2 weeks to feel okay.
Probably total about 2 weeks.
To like to
for
go
a
back to
patient who
work.
does office kind of work, after a week they can certainly go back to work.
Okay. And then the tummy tuck, how long do they feel good? Like takes 2 weeks again?
I would say about 2 weeks. I would recommend a patient to take about 2 weeks off before going back to work.
Okay.
And with both surgery, I wouldn't recommend patient doing any sort of heavy lifting or strenuous activities because that would raise their blood pressure and put them at risk for bleeding.
And then so no strenuous lifting or any stuff like that for about a month post-op?
For
6 weeks post-op?
3 to 6 weeks.
Oh, okay. So this actually takes a long time to rejuvenate oneself for this mythical wedding that's going to happen a year.
Now, but you mentioned about the pain. Now we actually have a system that can deliver pain medication gradually, so that we can actually, implant that into the patient with the tube, hook up to the outside, and that pain medication will, slowly secrete the pain medication for a period of about 3 days. So the first 3 days is when the patient has the worst pain. That would take care of that. After 3 days, you remove that pain delivering system. Then patient is, doesn't need as much pain medication to take by mouth anymore.
So the first 3 days they have this sort of pain medication that's delivered. This is most painful probably for the tummy tuck.
Tummy tuck, even breast surgery as well.
Oh, it's painful, okay. Yeah. And then, so that's why you have to be near the hospital, or near the surgeon.
Near the surgeon's office, so you can come back and have it removed.
Okay. So you don't think it's good to go get a budget discount plastic surgery, fly to India, get it for $100, and fly back? No, because then you'll have all these problems.
Well, I think that with any sort of surgery, there's risk involved, and the two major ones is bleeding and infection. And wherever you have the surgery, even though that risk is about 2%, but you have to be prepared to have that taken care of if you happen to be, in those 2%.
So, if you were going to this big wedding in June, and so in fact, short would be 6 months to get it done, because you have to wait 2 weeks before each surgery. You have to recover, wait another, and then have the surgery. So it would take 6 weeks if you did it sequentially, like facelift, wait 2 weeks, another 2 weeks, so 6 weeks. And then you have to spend time recovering, because you just can't bounce up and put your hat on and, put your lipstick on.
But I tell you, I have patient who had tummy tuck, right? And then came back to see me for 2 weeks follow-up for me to remove the drain. At that time, I took the photos. Patient's tummy already looks so much better than before she had the surgery. So at that time, even though she cannot, do strenuous activity, heavy lifting and whatnot, but she would be able to fit in her dress much better and she look much slimmer.
Right. But she might be in pain.
She could be in a little bit of pain, but again, most of the pain is for the first 3 days or so. Most of my patients, after about 5 days, they stop taking the pain medication.
This is hard work being beautiful. Hard work to prepare for a wedding. Now, for a take-home message for our home audience, we want them to understand that there's a lot of new procedures that can be done after massive weight loss, whether you have weight loss surgery or whether you are good enough to do the weight loss by nutrition or long-term care or Overeaters Anonymous. But once you have this excess skin around your face, your neck, your upper arms, your breast, the abdomen, even upper thighs, the excess skin can be removed. And if you're going to prepare for a big occasion, you have to plan time. Cannot just say 2 weeks before the occasion have it done, because you might still have swelling. And also it's important to consider the risks, although they're less and less with each year with modern surgical techniques. What else would you like to tell our home audience when they're considering this?
Well, I think the first thing they should do is go and have a consultation with their plastic surgeon. That way they have an idea of what their health status is, whether they need any sort of workup before they have the surgery, what kind of procedures recommend, and what would the cost be. That way they can better be prepared for the cost and the kind of surgery that they want to have.
We have to wind up for now. Thank you, Dr. Do, for joining us on Health Talk. We're really interested in this topic, and as we all have more birthdays, we will need to consider all these options, and we're all planning to be mother of the bride or some big party. We have to check it all out 1 year before at least so we can look our best. Thank you to our home audience for joining us on Health Talk. We hope that you will join us again, and if you like our programming, send your checks and donations to KSAR TV. We need support. And thank you, Dr. Do. I hope you come back.
Thank you.